Okay, so let's say you're going to start a patient on a vent. They newly intubated in the ICU, they rolled up from the emergency department or the OR, and you put them on the Hamilton. Well, the first thing you're going to do, or really your respiratory therapist is going to do, is they're going to choose the patient information. And right here you can see, is the patient male or female, and what is their height, right? Because this is what we record, and this is to determine their predicted or ideal body weight. So let's say this is a 5'2" woman, which is my height, and I am 5'2", which is about 157, 158 centimeters. So I'm going to scroll that back down, okay? And you can see, you put in the centimeters, and what you get is the ideal or predicted body weight. You can see right now that the mils, even though the tidal volume has not changed, the mils per kilogram of predicted body weight has gone up to almost 10. Why? Because we previously had this set to a male patient who was 178 centimeters. And in that patient, that was about 6.8 to 7 mils per kilogram. In a short woman like myself, you can see that this patient's getting way too high of a tidal volume. One of the things, now that you've recognized that you're giving poor me a tidal volume of almost 10 mils per kilo, let's say I'm a healthy patient. You want to put me on 8 mils per kilo. One of the things you can go to is you can go to the controls. Right here is where you can set everything you can possibly set in volume AC mode. And what you can see down here, though, is this tells you 500 milliliters is about 9.8 mils per kilogram predicted body weight. So you're going to say, I want to get Dr. Nonis down to 8 or less. So we're going to scroll down, and what you can see is you can actually see in real time when you get me down to there. So 400, 410 is about 8 mils per kilo. So let's just say 400, right? Great. And now what you can see, we'll give a few breaths like this. What you can see is the exhaled tidal volume has indeed gone down to about 8 mils per kilo. 2 thumbs up. So let's talk about modes in general. I think that the 2 modes that are most commonly used are volume AC and pressure support ventilation. Sure, there are a lot of other modes that we use, and we're going to go through all of them in due time, but we're going to focus now on these 2 main modes. One thing is that the Hamilton ventilator has different names for most of the modes than the Avia does, which is super helpful. Each ventilator, again, has a laminated card, which actually has the name of the mode in the Hamilton compared to the name of the mode in the Avia. Notably, we have updated the ventilator order sets to have both mode names at the same time. So when you go into the order set, you don't have to think, oh, I can't remember what volume AC is, because you will order volume AC / SCMV, which is the Hamilton's name for the same mode. So let's focus on volume AC, because that's what this patient's on. Right now, this patient, you can see their mode is SCMV up here at the top right. SCMV is the Hamilton ventilator's name for the volume AC mode. Okay? These are the 4 things, the 4 general things you're going to set, right? The rate, which you're going to go up or down with this knob right here. Let's say we'll put me on 18 breaths a minute, hit enter. You can do the volume, you can do the PEEP. Let's say I want 8 of PEEP. And let's say 40% because my sats are in the low 80s. We're going to go slow, right? Excellent. These are the things you're going to do in real time.